Hi, my name's Emily Bach. This is my NU650 comprehensive final exam. I give consent to be in this video. This is my mom, Evelyn. Do you consent to being in this video?
I do.
Perfect. And then just to show you our surroundings, we're on our couch in our living room. That's my supplies and the rest of the living room, so no prompts. Okay, so starting with the skin assessment, I can see her skin is an appropriate color for her ethnicity. I see she has, her skin is warm, dry, and intact. She has a couple of small nevi scattered throughout her arms and a few small freckles. They're round, small in diameter, maybe 1 to 2 millimeters. And then there's no border irregularities or other concerning symptoms. Moving on to her scalp, I don't see any lesions on her scalp. Her hair is evenly distributed, nice and full. There's no areas of hair loss or balding. Moving on to her face. Her face and head are normocephalic atraumatic. She has a neutral facial expression. I'm going to have you do some, make some facial changes. So I'm going to have you raise your eyebrows. I'm going to have you close your eyes nice and tight. Nice and tight. Squeeze your eyes closed. Good. Puff out your cheeks. Good. You can open your eyes. If you can frown. Good. And then can you show me your teeth? Good. Next one I'm going to have you do, I'm going to move on to your eyes. So your eyes are symmetrical bilaterally. Your pupils are around 3 millimeters in diameter, symmetrical bilaterally. Your irises are brown, your sclera is nice and white, your conjunctiva is clear with a little bit of vasculature that's normal. There's no swelling, drainage, any abnormalities there. I'm going to have you first check your visual acuity. So closing your right eye, covering your right eye, try to read the smallest line.
LTFPH.
Perfect. So next what I'm going to do is check your visual field. So looking straight ahead, tell me when you can see my wiggling fingers.
Now.
Good.
Now.
Good.
Now.
Good.
Oh, sorry.
Nope, looking straight ahead.
Now.
Good. And then next, follow my finger with your eyes. Good. So cranial nerves 2, 3, 4, and 6 are intact. Next, I'm going to check your red reflex. So looking straight ahead. Good. And your red reflex is intact. So next I'm going to check your pupils. So looking straight ahead. Good. Good. So you have both direct and consensual constriction. Next I'm going to check accommodation. Look at my finger, follow it with your eyes. Good, and accommodation is intact as well. Moving on to the ears. So I'm just going to take a look at your ears. So externally, the auricle, the tragus, and the external structures are symmetrical bilaterally. I don't see any lesions, nodules, any drainage, anything concerning. What I am going to do is take a peek inside. Okay. So I can see in the internal canal, the external canal, that it is free of foreign bodies, redness, cerumen. Next I'm going to look at the tympanic membrane, which is pearly gray. I'm able to visualize the conal light and the internal structures. Everything looks good. Next what I'm going to do is check your hearing. So I'm gonna have you cover your right ear. I'm gonna whisper three, like a combination of 3 letters and numbers, and I want you to repeat it back to me. B3E.
B3E.
Perfect. So now moving on to your nose. Your nose is midline, symmetrical bilaterally, without any discharge, drainage, or anything like that. I'm gonna take a look inside quick. Yep, thank you. So I can see that the mucosa is pink, it's not red, there's no polyps, drainage, perforated symptom, or anything like that. I'm gonna have you occlude one nostril and take a deep breath in. So that nostril is patent, good. Next, what I'm going to do is take a look at your mouth and your teeth. So your lips are pink, dry and intact. I'm gonna take a look inside your mouth.
Now.
So I can see that your tongue is midline, good, thank you. Your teeth are intact and white. Your gums are nice and pink. Can you say ah and stick your tongue out? Okay, good. So the uvula is nice and midline. The soft palate rises symmetrically. Can you move your tongue to side? Good. Next, what I'm going to have you do is swallow to make sure your vagus nerve is intact. Good. So moving on to your neck. I can see your neck is midline, symmetrical bilaterally. I don't see any obvious lymph nodes or there's no tracheal deviation. You don't have a goiter or anything like that. I am gonna feel your trachea, which is midline. I'm gonna feel your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, posterior cervical, superficial and deep cervical, and then sternocleidoid. So all of your lymph nodes are pretty much non-palpable. The few that are palpable are small, less than a centimeter in diameter, movable, and non-tender, so all normal. Next, what I'm going to do is check your thyroid. Which is firm. I don't feel any nodules. It's non-tender and symmetrical bilaterally. I'm going to have you swallow. Good.
I couldn't.
I felt you swallow.
All right.
So next, what I'm going to have you do is I'm going to have you grate your teeth. Good. So those muscles feel good. Next, what I'm going to have you do is I'm going to check your TMJ. So open and close. Good. So no crepitus, adequate range of motion. Next, what I'm going to have you do is put your chin to your chest for flexion. Good. And then extend slightly backwards. Good. Next is rotation. So look side to side. Good. And lateral bending. Good. So adequate range of motion throughout. Moving on from the head and neck, I'm next going to do the posterior, the thorax and chest. So on inspection, I can see that your respiration rate is about 20 per minute, easy unlevered breathing, no use of accessory muscles or retraction, so no signs of respiratory distress. Moving on to palpation, I'm going to feel your carotid pulse. I don't see any carotid pulsations or venous pressure pulsations. And then I can't see the maximum point on your chest because you have a shirt on. So next what I'm going to do is palpate. Any areas of tenderness?
Nope.
Good. I'm going to have you say 99.
99.
Again?
99. again. 99.
Good. Next, I'm going to move on to percussion. And take a nice deep breath in. Okay, and breathe out. And keep your breath out. Good. So diaphragmatic excursion's about 4 centimeters. Moving on to auscultation, I'm going to listen to the heart first. Good. So S1 and S2 are intact. I didn't hear any murmurs throughout. Next, what I'm going to do is auscultate your lungs. Take a nice deep breath. Good. Again. Again. 2 more times. Two more. Last one. Good. So I heard vesicular sounds throughout, which is normal. No adventitious breath sounds like wheezes or rhonchi. Next, what I'm going to do is I'm going to have you lay down on your back. And I'm going to assess your abdomen. So I'm going to drape you appropriately. I know. So looking at your abdomen, I can see your abdomen is flat. There's no bulges, there's no striae or any abnormal signs. Next, I'm going to auscultate. So she has normal active bowel sounds throughout all 4 quadrants, which is normal. Next, what I'm going to do is auscultate her aorta, renal arteries, iliac arteries, and femoral arteries. So aorta. Good. Renal. Iliac. And femoral. Good. I didn't hear any bruits, which is good and normal. Next, what I'm going to do is percuss. So I heard varying tympany and dullness, which is normal. She had like some dullness over her liver. Next, what I'm going to do is lightly palpate and then palpate more deeply. So moving on to more deeply and able to feel the liver edge a little bit. Take a nice deep breath in. Good, and out. I don't feel any masses. The kidneys are non-palpable and the spleen is non-palpable. Moving on, I'm going to have you cover your belly. I'm next going to palpate your inguinal lymph nodes, which are also small, mobile, and non-tender. Moving on, I'm going to have you sit up and take the blanket off. So moving on to the upper extremities, I'm going to feel your radial and brachial pulses. Good. Good. So first, starting with the shoulders, your shoulders do not appear to have any atrophy, tics, or any abnormalities. What I'm going to have you do is first flexion, so you're going to put your arm out straight and then raise it. Good. And then extension is when you reach out back. Good. Adduction is when you move it across your body. Yep. And then abduction, you're going to move your arm to the side and up. Good. And then for internal rotation, you're going to touch your shoulder blade. Good. And then external rotation, and then up. Good. So full range of motion to the shoulder. Next, what I'm going to have you do is we're going to check your elbow. Yep. So flexion, and then extension. Good. I'm also going to check the strength, so I'm going to have you bend forward again, and don't let me pull out. Good. And then for extension, don't let me push in. Good. So 5 out of 5 strength there. I'm also going to have you, so this is supination, pronation. Good. Moving on to the wrists. So flexion, extension. Good. Internal rotation, external rotation. And then for the fingers, flexion.
Down.
Yep. And extension. Good. And then adduction, abduction. Good. So I'm going to check that again. So I checked your elbows. So next what I'm going to have you do is make a fist. Don't let me bend you down. Good. And I'm also going to check your grip strength. Nice and strong. Good. And then abduct your fingers again. Don't let me close them. Good. So 5 out of 5 strength throughout. Next what I'm going to do is check your reflexes. So the first one is your bicep. Yep, just keep your arm nice and relaxed. Nope, so just like that. Good. Next, what I'm going to do is flexion. One more time. Good. And then the brachial radialis. Good. So 2+ throughout. Next, what I'm going to do is check your legs. I'm going to have you lay back down. And actually, sorry, just for 1 second. While I have you up, I'm going to check your, for tenderness in your back. And your kidneys. Any tenderness?
No.
Good. So the kidneys are non-tender, non-palpable. I'm also going to check your spine now that I have you sitting up like this. So you have the normal curvature of your spine. Any tenderness when I touch?
Mm-mm.
Good. So now I'm going to have you lay back down. So to check the hips, I'm going to have you flex the knee up. Just like then. Yep, perfect. And then I'm going to have you keep it extended. Don't let me push you down. Good. So you can straighten.
Down.
Down. Yep. And then try to extend your leg back where you push it. No. So it's easier if you roll over on your belly. Okay, lift this leg up. Good. Don't let me push it down. Perfect. Okay, you can roll back. So next what we're going to do is you're going to move this leg out for abduction and put it back. Adduction, good. You're going to bend your knee and then internally rotate, good. And externally rotate, perfect. So I'm going to check your strength for the abduction and adduction. So don't let me push your legs together, good. Don't let me separate your legs. Perfect. So 5 out of 5 strength again. Moving on to your knees. Your knees and your musculature looks good. There's no signs of any muscle atrophy. Your knees don't appear to have any swelling or any type of issues there. Moving on to the range of motion, I'm going to have you bend your knee. Good. And push out. Good. And extend again. Oops, sorry. So keep it bent. And then don't let me push out. Sorry. So bend it. Kick out towards me. Good. And then don't let me push your leg out. Good. Next, what we're going to do, so that was 5 out of 5 strength as well. I'm going to check your plantar and dorsiflexion. I'm going to have you point your toes towards you. Don't let me push down. Good. And then point your toes away. Good. Don't let me point your toes up. Perfect. So 5 out of 5 strength as well. I'm also going to assess your femoral, popliteal, and pedal pulses. 2+, 2+, 2+, and 2+. So the camera can't see me. And 2+. Perfect. So next what I'm gonna have you do is stand. Oh, sorry, one more thing. I have to check no peripheral edema. Any tenderness?
No.
Perfect. I'm gonna have you sit up so I can check your reflexes. Let's try on this side. So diminished reflexes, checking that ankle reflex. Good. 2+, normal. Good. So next what I'm gonna have you do is stand up. I'm gonna check, moving on to the rest of the nervous system. I'm going to have you stand up. I'm gonna have you just walk back and forth.
Like here?
Yep, just to check your gait, which is steady, rhythmic, no issues there.
Stay standing.
Yep, so what I'm gonna have you do next is walk heel to toe. Good. Next what I'm gonna have you do is walk on just your tippy toes. So you wanna take your flip-flops off. Good. Next I'm gonna have you hop on one foot.
Oh boy. I don't think I can.
Oh, not just in one spot. Oh! Here,
Oh God.
I can hold your hand.
Okay.
Good, perfect. Next what I'm gonna have you do is the Romberg test, which is when you stand feet together with your eyes closed. It's just gonna be for a few seconds. Good. Minimal sway, perfect. So next what I'm gonna have you do is put your arms out straight. Close your eyes. Good. And the other thing that I want you to do is, it's called a low knee bend. So you're gonna bend on balancing on one leg.
Oh gosh.
I'm gonna hold your hand. So stand up straight. Yep, and then bend. Good, perfect. Next, what we're going to do is I'm gonna have you take a seat, and I'm gonna check your sensation for the sensory part of the nervous system. So, starting with your face, I'm gonna have you close your eyes. Tell me when you feel the touch.
I felt it.
Okay, say now when you feel it.
Now. 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 Now.
Perfect. So next, what I'm going to have you do is distinguish between sharp and dull.
So I
You can't
close
open
my
your
eyes.
eyes.
Oh.
So this is soft, that's dull, this is sharp.
Okay.
So you can close your eyes again. Say sharp or dull.
Can you do it one more time? I missed it. Sharp? I can't tell.
So let's review one more time. So dull,
Okay.
sharp.
Okay.
Close your eyes.
Sharp.
Good.
Dull. Sharp.
Good.
Sharp. Soft.
Good. So that's intact. So usually if you weren't able to distinguish between soft and dull, we would move up to temperature, but that's intact, so we don't have to. Next, what I'm going to do is test vibration. Or actually, I'm gonna do, instead of vibration, I'm gonna do the distinguishing. I'm gonna have you distinguish a few things.
Okay.
So if you wanna close your eyes, put out your hands. So this feels like, this is 2.
Can I open up my eyes, or am I supposed
For
to?
right now, you can
Okay.
have your eyes open. So that's 2. That's 1. I'm gonna have you tell me if you feel 2 or 1.
Oh, okay. 2.
Good.
1. 2. 1.
Good. I'm also going to have you, I'm gonna draw a number in your hand and I want you to tell me what you feel.
Oh, are we still going?
What is it?
3.
Perfect. I'm also going to have you, I'm gonna touch you on random spots. I want you to tell me where you feel.
With my eyes closed,
Yes,
obviously.
with your eyes closed.
Okay. My knee. Well, right here.
Yeah.
Right here.
Yep.
My stomach. My shoulder.
Good. And then I'm gonna have you tell me if you feel, if you're being touched in 1 spot or 2.
1. 2. 1.
Good. You can open your eyes. Next, what I'm gonna have you do is I'm gonna put an object in your hand and I'm gonna have you identify that object, okay?
Mm-hmm. Can I, oh, it's a Q-tip.
Perfect. So that would conclude our comprehensive exam. All systems were within normal limits. Thank you so much.
Thank you.